Welcome to our practice. In the next 10 minutes, you will learn a few important items like what is peripheral neuropathy, what are the causes, what are the common medical treatments, and what are some of the new methods being used by clinics like ours and around the country. Our system is different than most because we offer a cutting-edge 21st century technology to promote nerve healing, unlike the traditional medication route that only hides the symptoms. This allows us to turn off the painful nerves without the side effects like sedation, dizziness, and swelling from some of the other medications on the market that treat neuropathy. Before we discuss treatment, let's talk about what peripheral neuropathy is. Peripheral neuropathy is a nerve disease, which is why many will get nerve symptoms such as numbness, tingling, prickling, burning, and painful nerves. This attacks your peripheral sensory nerves starting at your feet or hands and working its way back towards the heart. It will attack your nerves in a stocking or glove-like pattern. This will wrap around all of your toes in the beginning and then progress through your feet and up your legs in a stocking pattern. The same goes for the fingers and the hands for some. Peripheral neuropathy is caused by lack of oxygen and stimulation of the nerves, which leads to the shriveling up and death of nerves. This is much like a plant dying when the nutrients from the roots fail to get to the plant. Plants need healthy soil, water, and sunlight, just like your nerves need blood, oxygen, and nutrients. Once deterioration of the nerves starts, you will start seeing the symptoms that brought you in the office today get far worse as time goes by. In the case of the dying plant, if we add sunlight, good soil, and water, the plant will come back to life, just like your nerves will in the right environment. Traditional medical treatment uses anti-seizure medications like Lyrica, gabapentin, or Neurontin, and antidepressants like Cymbalta. As your pain gets worse, you will eventually be prescribed harsh narcotics like Vicodin and OxyContin to treat nerve pain symptoms, but not the numbness. Imagine complaining to your gardener about that dying plant in your yard, and all he did was put a large box over the plant so you didn't see the eyesore anymore. Now you cannot see the plant, and if you leave the box there long enough, the plant will eventually wither and die. This example is no different than what occurs in medical offices through the country. A patient comes to the doctor who complains about neuropathy symptoms. Diagnostic tests may be ordered, and then a diagnosis is rendered, which leads to treatment. The goal of treatment is to reduce your symptoms caused by dying nerves until they are completely dead, leaving numb areas on your body forever. Our treatment is very different. We still address any neuropathy symptoms first, but we also understand that just like the plant, without sunlight, water, and healthy soil, the plant will eventually die. Our goal is to catch your nerves before they are completely dead so we have the opportunity to repair them using our proprietary neuropathy treatment system. The most common cause of neuropathy is from diabetes. This is a disease that will affect blood flow and circulation. That's why some diabetics develop ulcers and have foot amputations. If you cannot carry blood, oxygen, and nutrients to your nerves, they will eventually shrivel up and die, like the plant without sunlight, soil, and water. Most diabetics do not understand that they can develop neuropathy with controlled blood sugar levels with medication as well, which is why dietary restrictions are included in our protocol. Toxicity from chemotherapy is another common cause of neuropathy. This kills the nerves and also will affect the body's ability to carry oxygen to the nerves and affects areas furthest from the heart first, such as your hands and feet. Some people will have their symptoms improved naturally, but many end up in offices like ours because the numbness and pain did not improve. Another and very common type is from age-related idiopathic reasons. As we age, our body begins to degenerate and our heart doesn't pump as hard, resulting in less than optimal circulation. This leads to a combination of decreased blood supply and aging nerves. We have many of these types of patients that develop this condition in their 60s or later. Healing the nerve in this case breaks the degeneration cycle and starts the healing cycle. Other environmental causes of neuropathy can come from statin cholesterol medications, chronic alcoholism, viruses, and some autoimmune conditions. In all of these cases, the blood vessels around the nerve act like the root for the plant in the earlier example. When there is lack of oxygenation to the nerve, eventually it will begin to shrivel up and die, leading to various peripheral neuropathy symptoms. Now you have neuropathy symptoms, but the process started long before you had symptoms. The frustrating part about this is when you see your family doctor or neurologist about this condition. They can order many expensive tests to rule out other disease conditions, and eventually they come to the diagnosis of peripheral neuropathy or polyneuropathy. Treatment for this condition under the traditional medical model is very poor, and insurance will only cover medications which include Lyrica, gabapentin, Neurontin, Cymbalta, and narcotics. These fall under anti-seizure medications, antidepressants, and the narcotic category, which do not treat the actual problem you have. They are like that box over the plant. The goal for the traditional model is to treat the nerve pain until the sensory nerves are completely dead, and then you will have completely numb legs or hands for the rest of your life. What's the risk in this traditional model of treatment? Those sensory nerves have many functions, and one of them is measuring pressure. If you cannot assess pressure, it's hard to balance effectively because you don't know how much weight you are placing on one foot. It is hard to know how much pressure you are placing on the gas or brake in your car, or if you are even stepping on the correct pedal, which is extremely dangerous, and remember, is grounds for someone to lose their driver's license. Without those sensory nerves, it is even hard to notice other health issues. You may have an ingrown toenail that becomes infected, and without the sensory nerves, you will not feel the pain from an infection. If the infection persists, this could lead to an amputation. If you can't feel the pain from the infection, this does lead to foot amputations in some cases. Neuropathy sufferers may also fall over and break their hip or other bones because of their neuropathy-related balance issues as well. So I find that this condition is much more serious to folks than the medical community acknowledges. Our approach to all conditions is safe, simple, and effective. The first step we provide is pain and inflammation reduction because it is necessary to start the healing process. Whether you have pain or not, we treat the nerves first. We know that the nerves are starved of oxygen, which is why we use a proprietary type of LED light therapy, which uses photomodulated pulsed light therapy, which delivers safe, warm, and effective light frequencies to help heal the nerves by improving circulation. Circulation will help oxygenate your nerves and provide additional nutrients to facilitate the healing process. Second, since your nerves originate from your spinal cord, utilizing deep tissue laser therapy on the spinal column and legs will release additional nitric oxide, which opens up your arteries, increases circulation, and actually will contribute to the production of new tiny blood vessels over time. Laser will increase the production of nerve growth factors that are essential for proper nerve function and repair. Using this in conjunction with our low-level light therapy provides a great combination to regenerate nerves. Third, vibration frequencies over 6 times per second to the nerves will stimulate the nerves, which again facilitates the healing process. Other therapies may include detoxification therapy for certain chemically induced neuropathies. This is a simple detoxification supplement that will remove impurities from your body. This does not mean you will be stuck in the bathroom either. We also use our proprietary liquid micromineral known as fusion minerals, which provides essential nutrients to help the nerves heal. Part of healing the nerves is improving circulation and decreasing inflammation. Circulation is improved with nitric oxide enhancing supplements, and inflammation is reduced with diet and supplementation. This may sound like a lot, but this unique combination of treatments is how we are able to achieve better outcomes compared to taking dangerous medications for an indefinite amount of time that only leads to numb nerves with side effects from the medication. Now that we have explained the diagnosis and the procedure, let's answer some common questions. Regarding insurance, the only portion they would ever cover for neuropathy is the drug-based treatments. Insurance companies typically cover medications first and new therapies last. Rather than waiting around for another 15 years for insurance companies to catch up, we know that treatment outcomes trump insurance coverage for most patients. Because we are able to achieve great results in less visits, we have been able to minimize our costs to you and offer payment plans for patients to make it easy for them to receive the care they deserve. Regarding guarantees of results, we cannot state that, nor is it legal for us to guarantee a medical procedure. Most patients, however, do see results in their first few visits, unlike surgical procedures that may take up to a year to determine if it was actually successful. In fact, it is not uncommon for a patient to walk into our office using a cane for balance on their first treatment and return without it by their second visit. This risk is minimal and much less than the long-term effects from the medications that are currently used to treat this condition. Treatment frequency is typically performed 2 or 3 times a week for a specific amount of weeks based on the severity of your neuropathy. Maintenance after the program will involve a healthy diet and exercise. Now that you have heard about our program, open the door to let the specialist know you are ready for your consultation.